Hi, I'm Dr. Tish with our MedMinute question for the week. This week's question is, how does ketamine help with chronic pain? And that's really a great question. It's one that we face a lot. So I'm going to talk about both aspects of that. Ketamine has been used in anesthesia, in surgery, and in veterinary medicine for anesthesia to sedate people. And it's been used for a long time. Somewhere along the line, it started being used as an outpatient in low doses to treat depression that didn't respond to traditional medications, antidepressants, and even shock therapy. So in much lower doses that we would use than putting you to sleep, it was used for that treatment. And it helped reset neural pathways. So it helped treat or break the cycle of depression. What happened was it was so beneficial for that people had such a high safety profile that people started using it for other things. First, they started using it for anxiety and panic attacks. It worked well for that. Then it started expanding into chronic pain, whether it be something that happened immediately after an accident or something, which is called acute pain, or chronic pain. And then there's other pain syndromes where people have pain that's out of proportion to what's going on. And those are what we call different types of pain syndromes, as well as fibromyalgia and things like that. So it's been expanded for all of that use, and it has had amazing results. Now, it's not 100%, unfortunately, but many people get a significant reduction in their pain. Even people who have to have surgery, like for herniated discs, and we are waiting to have that surgery, can get ketamine infusions, and it really helps reset that pain level down a bit. Because what happens to your body when you are having pain after a while, your receptors in your brain get hypersensitized. So what happens is they keep firing, so your pain levels go up with time, even though what's really going on is not changing. You don't have more of an injury or anything like that, but your perception of it goes up. And so those are called NMDA pathways. And so what ketamine does is it resets those. And this is the way it worked for depression and anxiety, but in this case, it's working for pain. It basically helps reset the pathways, not turn them off, not block them, but reset them. So it resets them to a lower amount so that your perceived level of pain is probably more to where it should be. Now, some people get complete pain relief after the infusions, and it stays that way for a while. Some people need several infusions to do that. And unfortunately, there is a small percent that get no benefit, but that's very rare. Most people get some benefit. So the gold standard is IV ketamine because you get the highest dose, the highest resetting of the receptors with that. Some people will respond to that, but it comes back a bit. So then we might switch them to an outpatient form, which can generally be nasal spray, or there's another type that goes in your mouth called a troche. It dissolves slowly. And those are meant for outpatient use. So if they're having some pain syndrome and it comes on episodically, a lot of times people will be doing good and they'll have a flare of pain, and it just is for a short period of time. That's where the nasal sprays come in, because it will stop it right then. And so it helps break that cycle so they don't have to get the infusions all the time. So there's a lot of opportunity to help control pain with ketamine IV or ketamine nasal spray. And in fact, we've had tremendous success with treating cluster headaches and migraines with them. So it's something to consider if you struggle with pain. It's worth looking into for sure, because it's another opportunity. It is not a pain medicine, so it's not an opioid. It's helped to treat the problem. So keep giving us your questions and submit them down below.